Good morning, Albuquerque and folks who are tuning in. This is a return to our COVID briefings. We had a wonderful 2 months off, but for all sorts of reasons, which we're going to talk about, and I think which people are aware of, we felt the need to provide an update from the city's perspective on where we're at with respect to the resurgent pandemic. And so today we're going to talk about where specifically the Albuquerque metro area is with respect to our public health. And we're also going to remind everyone about the support that we're providing, especially this week that we are releasing about 7.5 million economic relief. And so we very much want folks to apply for that if they haven't already. Now, I think I would like to begin by saying, unfortunately, there is obviously a high uptick in the Delta variant of the COVID virus, which is much more contagious than other COVID mutations that we've seen. And the good news is that Albuquerque is still doing very good with respect to our peers. And so again, we want everyone to be healthy, but I think it's also always important to benchmark where we're at with respect to other cities, because we know this is a challenge, not just all over the country, but nationally. And so what I'm going to do is switch over for a minute to some of the same metrics that we looked at, for the last 18 months. We've got a refreshed version for you. And so bear with me while I set up screen share here. Okay, so right now you should be able to see our presentation. And I want to begin by highlighting where we are compared to these other cities, of course, that you see in the West: Denver, Tucson, Austin, Los Angeles, Phoenix, Salt Lake, El Paso. And we also like to try and throw in there Oklahoma City. And you can see that when it comes to the confirmed number of cases, here we have the second lowest confirmed number of cases. And as a reminder, we'll talk about these trends over time, but this is just a snapshot of where we are now. But these numbers are getting very high. So it's, I think on a comparative basis, we're doing quite well. But what you see all over the country and in these cities is, these numbers are back to yellow level era of COVID positivity totals. And then if you look at the percent positive, here again, you see a similar situation where we have the second best rate, if you will. Denver does have a little bit lower rate. But if you look across some of these other cities, you can see, Phoenix is in a very vastly different situation than us, literally 3 times worse. And it's the same with Salt Lake and Oklahoma City, 4 times worse in terms of positivity rate. So again, we're demonstrating here, I think, 2 things. One, that these numbers are on the rise, and they are very much similar to what we would have seen back in April and May of earlier this year. And unfortunately, we're seeing, and we also know because of travel and family and things like this, seeing these other cities have these increases certainly is going to impact us indirectly. And then also, if you look at vaccination, you see us again in that number 2 position. So sort of second best, if you will, but second highest level of vaccination. Denver doing substantially better. But these other cities are in very, very different situations. Only a third of Austin, a third of Phoenix, roughly. And you can see the other statistics there. Very concerning just with respect to spread and the issues that we're seeing all around the country with the rise in virus. And so it's fairly obvious, but you can see in those numbers a correlation between the percent vaccinated and the positivity rate. And so yet another reminder how important these vaccines are for everyone to get, especially to reduce transmission. So even if you're not sick, or even if you don't feel, you don't have strong symptoms, you can still pass it on to others. And we also know that, there are situations where that happens even when people are vaccinated. But the difference is the likelihood. So statistically, you are just much, much safer with a vaccine, and you can keep others safer around you. So at the city, we're doing a couple of things, which I'll get into, but let me share with you a little bit of how this looks over time, because I think this is a really important perspective to understand in terms of the steepness of these curves. So, when we look at historically what's happened, we see these, huge increases in the winter. We saw that, and then you see things leveling off in the spring, but now you see all of a sudden a continued rise in the number of cases. And similarly, interestingly, these cities have kind of performed the same throughout the pandemic. So we have been either first or second in a good way on this ranking throughout the entire pandemic. And you see these other cities, now literally sort of off the chart in terms of their increases. So similarly, when you look at this percent positivity rate, this one is a little bit, the beginning time frame on this is earlier in that this is just for 2021. And so you see how bad things were right in the winter when we were still sort of in the heat of that third wave of the pandemic. And then you see things come down over the spring, which was great. We're reopening and everything like this. And then look at this incredible inflection point right around mid-June, everything started changing again. And you see these numbers going up. And you can see for some of them, like Oklahoma City and Phoenix, incredibly steep increases. So for us here again, we're in a very good position, but you still see that increase. And so this situation basically hasn't changed, except that we're all rising together, but we're doing a little bit better than others. And it's probably due to our vaccination rate. So speaking of vaccination rate, when you think about the metro area with respect to the rest of our state, in the Albuquerque area, we are doing, especially for partial vaccination and really for percentage of fully vaccinated residents, you can see we're doing at least 10% better, if not in some cases 14%. So Albuquerque Metro, it's great that we have a higher vaccination percentage, but we also know, as we've reminded everyone throughout the pandemic, that our state flows through Albuquerque. So whether it's for healthcare, or for the malls, or for Topgolf, or whatever it is. And so we want to look at these two numbers in conjunction. But you also see one good thing that, New Mexico, again, doing better than the rest of the United States. But similarly, we know with traveling and so forth, all available, that, we are susceptible to obviously the communities and states around us. So speaking of that, this is a map, and this has been on a lot of the different, news channels and reports and things like this. But you can see here, this is the transmission rate, and red is not good in this case. And you can see that, we are in a situation where the whole country is experiencing very, very high increases in community transmission. And actually, I think if you look at the scale on the right, I think the high end is actually turquoise in this situation. Let's just check. Is that? So I think without going into like county by county, we'll let folks, if you have questions on this, but obviously it's a national map, but you can see where we're at here in New Mexico. And you can see that, certainly a concern for our county. Okay, so let's talk about a few other aspects of this. I think for us at the city, what we're doing is we are requiring masks again. Now we're just doing it for ourselves at the city government facilities. So any city government facilities, you'll now have to wear a mask, whether it's community center, library, all of these things. And of course, our city employees will be wearing masks as well. And we certainly would encourage others to do the same if they feel it appropriate. And we just think that's just the shortest, most quickest way to try and reduce spread. That, also, we're all sick of wearing a mask, but that actually is the easiest thing we can do that helps the most. So it's a very small sacrifice, a small thing you can do to keep ourselves safer. And this is in step, of course, with Bernalillo County and with the Water Authority and the APS. And we know my kids included are starting school next week. And so they are mask ready. Now, we want to talk about some of this in a little bit more detail, but I also want to mention that you can get free vaccinations at most pharmacies and many grocery stores. Vaccinations are very easy to get. Basically, you can call 311 or you can just type in Google, keyword vaccine, Albuquerque, and everything will start showing up. Now, we also know that we have our FEMA mobile team working in the metro area, providing vaccinations in particular neighborhoods. And you can check out that schedule at vaccinenm.org. And also, we're going to have vaccines available at our Summerfest events, as we have been, and at the cycle racing this event. So when we can, we're going to also try and provide that at our different public events. And so getting tested is free. It's very easy also. And so you can do that at curative.com. And again, that's really important. Even if you don't feel sick or your symptoms aren't that bad, please get tested. And the reason why is just to protect everyone around you, your family especially, and your coworkers. Because even if it isn't particularly, you're not, having to go to the hospital or anything like that, you might spread it to someone who's in a much more compromised situation, and then they end up in the hospital. So again, sort of a refresh on the reason why we really have to help out each other by taking on that responsibility to wear a mask, get tested, and get the vaccine. And again, the vaccine, I would just wrap up with, is really, we're hearing a couple of analogies around the country. And I think for us, we've had some monsoons, it's been raining a little bit, and your mask is like an umbrella. It helps you in the rain. But if it's one of these, late afternoon monsoons where the rain's going sideways at you, the umbrella doesn't help. And so what you need in that case is the vaccine, which will help you in that case. So that's sort of more of a raincoat, if you will, which, pretty much none of us own here in New Mexico, but you can, have at least that additional protection. And of course, there's always statistically going to be some examples where neither of those will prevent the virus from affecting you. So with a little bit more on this, let's hand it over to our own Dr. Mark Demena from Environmental Health. Mark?
Thanks, Mayor. As Mayor showed with the rising curves, one of the things that we're seeing over the last few weeks is a sustained trend towards increasing counts of new COVID cases, which we had seen a long-standing leveling out or even a dip. So obviously that's a concern for us that trend now is going on, and it's actually increasing, getting more severe. There are some examples of vaccinated individuals that are making up some of those numbers. I'm going to talk some more about that, but they're largely the minority. This is very much now an issue of unvaccinated people driving a lot of those numbers. And Delta, unfortunately, is going to tear through the unvaccinated community, as it has been throughout the rest of the country and other parts of the world, even faster than the previous strains of COVID that we saw, just because of the nature of its infectiousness. And I'll talk some more about that as well. As Mayor said, we have a very high vaccination rate in general in New Mexico, and that is actually exemplified very well in Bernalillo County and the metro area. One of the things that you see when you start breaking that down further, though, as we've seen from the state's data that they're collecting, the highest percentages are amongst the ages 65 and up. That's at about a 75% fully vaccinated rate. And then the next age category down, age 40 to 64, that's at about a 64% vaccination rate. All of the other age groups that go lower than that, all the way down to the youngest age groups, which in this case obviously would be age 12, the lowest age that can be vaccinated, those are actually under 50%, like kind of hovering in the 40% range. And unfortunately, a lot of the cases that are coming in New Mexico, and consistently throughout the pandemic, we've seen the highest demographic being about age 20 to 40 in those categories. Those over time have made up about a third of the cases, and they continue to be the highest represented set of cases. So that's an age group that doesn't have as high of a vaccine uptake currently. And unfortunately is also one of the age groups where a lot of those people are probably out working out in the community and have school-age children. So as we get back into school next week, that's going to be more of a concern. So that in particular is a group that we would like to see the vaccination rate get even higher. Vaccines, despite what people may be hearing, continue to be the most protective step that you can take. There are situations where Delta is infectious enough that it's getting some vaccine breakthrough. We do have some, and a growing number, as CDC has changed the way they're tracking, and a growing number of documented cases of vaccinated individuals that are testing positive for Delta variant. But it's important to differentiate what you hear in the news as those sort of alarming trends versus what the actual percentages look like. It's still a very rare situation for a vaccinated individual to get sick. in those cases where they do, the vaccine continues to be very protective. So almost 100% of the cases where people are being hospitalized now, where they're dying from COVID, are among unvaccinated people. So we still have a very, very high protection factor for vaccine, and that's why it continues to be so important. If you're vaccinated, you don't have to die from COVID. You don't have to end up on a ventilator. You may get sick. You may not even know that you're sick. Very mild illness, it's still possible, but you're not going to get as sick. And we're seeing that in what the state's reporting for hospitalization rates as well. The hospitals are not really under threat for capacity right now because a lot of these cases are just not ending up there. But as we continue to see that spike increase among the unvaccinated, then you'll start to see hospitalization rates and death rates potentially a factor again as well. So it's very important to continue to maintain that focus on vaccination, continue to maintain that focus on protection. Mayor talked about masks. That's very much the simplest, easiest, most fundamental way still to lower your chances, whether you're vaccinated or not, of becoming infected. So we still encourage people to wear masks. We're wearing masks in City Hall and asking the public to do the same. I think it's important to understand with Delta, one of the reasons that it's so infectious is because it creates a very high viral load in people that are sick. So if you cough and you're infected, you're gonna have much more virus in that cough than any of the previous strains of COVID that we saw, and that makes it much more infectious. So it actually is very similar to the monsoon example that Mayor provided. You just get so much of a deluge that even with a great raincoat or an umbrella, you're bound to get wet at some point. The virus just has so much pressure on people that are being vaccinated that there's going to be some occasional breakthrough. What we're most concerned about is people who are potentially vaccinated and believing that they're no longer at risk. If they do become ill, one of the other things that's very critically different from Delta, this is the first strain of coronavirus that we've seen since we have had vaccines available that can build up enough of a viral load in the person that's sick. And that's why I said this is a very important thing to understand. It can build up enough virus to actually allow someone who's been vaccinated to potentially, and again, this is rare cases, but to potentially transmit their infection to someone else. Vaccine so far has protected with all other strains against that happening. But with Delta, someone who gets sick, even if it's very, very mild for them, can equally pass along virus to someone else. Now, if that someone else is vaccinated, you start all over again with the very rare chance that they're going to get infected, the very rare chance that they'll pass it on. So vaccine provides buffer at each of those steps. But I think you can see what I'm driving at is the biggest concern that we have is a vaccinated person can potentially pass along a coronavirus infection to someone who's not vaccinated. And at that point, the person who's not vaccinated is equally at risk of severe illness and death as they were if they got coronavirus in any other way. The reason that that's so important and so timely for us now, and the unfortunate timing of Delta creating this huge surge when it is as kids go back to school, kids under the age of 12 nationwide are still not eligible to be vaccinated. So parents who may be doing everything they thought they should do, they got the vaccine, they're wearing masks, they're being very careful, they may be exposed to Delta someplace, get sick, have a very mild illness, but pass it on to their kids and risk their kids being very, very sick, starting an outbreak in their school, infecting other adults at the school, or any of those people involved in that outbreak ending up in the hospital. So the risk continues to be very real. The vaccine continues to be the best protection for that. One of the things that's been going on with all of this is that as we continue to see a lot of coronavirus transmission in the general, the world at large, and it's largely among the unvaccinated community, it's continuing to mount this pressure. The more times that someone becomes infected and passes on an infection to someone else, the more opportunities there are for the virus to mutate, and the more coronavirus there is out there in general that can infect other people. So we won't get past thinking about COVID as a pandemic and being a real risk to people until we can actually stamp out a lot of that transmission to the point that it's just not really happening. This isn't something that can continue to go on, but it's somebody else's problem in another part of the world or somebody else's problem in another part of the community. As long as there are unvaccinated individuals that are allowing high levels of rapidly circulating transmission, we risk continuing to see different variants that may come out and put people at risk. So there are other variants beyond Delta. Some of them will be more mild. Some of them could be even more severe. And as long as we continue to have this ongoing transmission, that continues to be a growing risk. So as we just continue to push this issue of vaccination, that's really why we're trying to get to a point where we're actually curbing transmission for the entire community, the entire country, the entire world, so that we can truly kind of get past this point. And it was, we heard this morning expressed by some public health experts, and I really thought it resonated, that at this point, with the amount of transmission that's still going on and the infectiousness of something like Delta, if you're someone who's chosen not to be vaccinated, you essentially have chosen to get coronavirus. It's not really a matter of if, it's a matter of when. Because this virus is so infectious, because there's still so much transmission happening in the community, if you're not vaccinated, it's extremely likely that at some point you're going to be infected. And that's really the decision that people should be weighing. Having said that, we very much understand that there are a lot of people that still feel uncertain about the choice to be vaccinated. One of the largest things that we've heard in the community is that people continue to be afraid. They feel the vaccine may have been rushed. They feel it may have been not subjected to the same scrutiny. I think that argument was probably more valid at the turn of the year earlier, when 2020 became 2021 and the vaccines were new. But just for a thought on safety for anybody that feels this is maybe an untested vaccine choice, a typical phase 3 vaccine trial would have maybe a few thousand to a couple of tens of thousands of people enrolled that they would test the vaccine on. And then once they feel that they've demonstrated safety and a greater benefit than the risk, then that vaccine can be fully approved. In this case, at the beginning, it was a brand new vaccine, and it was still moved through very quickly to try to minimize what the absolute minimum number of people in the phase 3 trials were. But at this point, midway through 2021, 165 million Americans have been fully vaccinated. And around the world, that number just grows even exponentially. So we are far, far beyond what a typical phase 3 trial would be to demonstrate safety of a vaccine. And we have yet to see any serious side effects or risk to people's health or their lives. So this is a very, very safe set of vaccines that we have, and we have tons and tons more data than we typically have to prove that. So I'd encourage people to kind of talk to their healthcare providers or somebody that they feel like they can trust that can help sort of talk through some of these things. But the vaccines continue to be just a very, very safe alternative. And it's really the thing that's going to prevent this from being an ongoing issue and something that you put your own health and especially the health of people around you that are still vulnerable at risk. It just isn't necessary to take that risk anymore. We have a very safe, very viable option with the vaccines that we have. So, take-home message continues to be that's the best possible protection you can take. But take Delta seriously and follow those same common sense precautions that we've been talking about all along. And thank you.
Thanks so much, Dr. Demena. And we want to talk about also what is available, because we know that businesses are still trying to, one, grapple with the resurgence of the coronavirus, but also still trying to recover from everything that we've been through. And fortunately, this week, the city was able to release 7.5 million available for small businesses. And these applications are online now, and there's several different categories ranging from family-owned businesses to hotels and public safety related grants, even to arts and entertainment and youth and education sector grants. So this is part of our release of stimulus funds, and these are available now just in time for sort of this difficult inflection point that we're in. And so these are available to all Albuquerque small businesses with 50 or fewer employees. And you can find more information at cabq.gov/recovery grants. Now, I think we'll go ahead and begin to wrap up, and we can certainly take some questions if there are some. I would mention, as we look to the future, one thing we're paying close attention to is obviously the opening of APS and our other schools in the Albuquerque metro area. And what I think we're going to see is a real inflection point, for better or for worse. We may see a spike in cases, in which case we'll have to take appropriate actions. We may not. We may see just the same trend that we're seeing, and it didn't really make a difference when our kids went back to school, but we're going to find out in the next few weeks. And so that's why we're continuing to monitor the situation, and we will certainly revise our policies and our guidance once we see how that plays out. And of course, we want everyone's children and our teachers to be safe. But that's happening as I know, as I gear up for before school shopping for my kids. So we'll know in terms of where we're at as a community with much more certainty in just 3 to 4 weeks. So as we look to the fall, I would also add that there is a real question over whether we're just going to have to live with COVID for a long time, and if we're going to treat it like we do, for example, the flu vaccine, where there's a big push and it's available and these kinds of things, and or there'll be new variants and things like this. We don't know, but I do want to mention that over the long term, it's possible we have to deal with corona much like we do the flu, where it's just something that we try and push down and bat away every fall or not. So that's what's on the horizon for fall, and we'll continue to manage through that. But we are preparing for different scenarios in the fall with respect to increase in transmission rates of all viruses that always happen as the weather gets colder and as our kids are still in school. And we do know that in that situation as well, even if it's for the flu, face masks are helpful. So they're always encouraged. Okay, with that, I think either Maya or Danielle is going to organize some questions.
Hi, Mayor. Yep. First, we have a question here from Ryan Laughlin. Ryan, I'm getting you unmuted now.
Can you hear me?
We sure can.
Perfect. Mayor Keller, can you expand on the $7 million? Who can apply for that, how, why it's important, and when that money will be dispersed?
Sure. So just to reiterate, folks can apply. First off, call 311 if you have questions. And also you can apply at cabq.gov/recovery grants. And these are part of the stimulus money that we got back in the spring that we're now able to hand out. And in terms of the timing and when those checks will actually be delivered, I'll hand it over to our Director of Economic Development, Cynthia Jaramillo.
Thank you for that, Mayor. Ryan, yes. So the grants will be awarded at several pickup events starting this month in August and September as they are approved, and all grants will be funded by October 1st. Now, again, these grants are available to all Albuquerque small businesses with 50 or fewer employees, and you can find more information at cabq.gov/recovery grants. You can also, so we're encouraging folks to please apply soon. That link I'm happy to share in the message panel here, but that link is abqgrant@cabq.gov.
Thank you so much.
All right, next we have a question here from Jessica Dyer at the Journal. Jessica, we will get you.
I think we lost your audio, Maya. Jessica, it looks like you can unmute though. Go ahead and ask your question.
Okay, it looks like I have a question here from Jessica Dyer. You shut down grant applications for family-owned and startup businesses less than a day after opening them. How many applications did you get in those categories? And what % of the 7.5 million were you dedicating to those categories?
So I'll let Cynthia fill in those details. A lot of the requirements for this were scripted by the city council ordinance that appropriated the money. So we did have to follow those rules that were given to us. But for more on that, Cynthia, go ahead.
Certainly. Thank you for that question, Jessica, and thank you, Mayor. And so yes, yesterday we received more applications for the family-owned and entrepreneurial grants than can be funded, but we are encouraging all small businesses to take a look at the requirements for the other 4 grants to see if they meet the qualifications. Our small business office staff is also here to help and assist. And to answer your question about, Jessica, the family-owned and entrepreneurial grants, City Council allocated $2 million in that category.
All right, thank you, Cynthia. And it doesn't look like we have any other questions at this time. So thank you all for tuning in today.
Thanks, everybody.